How can you treat cancer? So currently, as of 2023, there are 8 main ways to treat cancer. I'll try and remember them all. So people often talk about the 3 pillars of cancer treatment. So that's surgery, chemotherapy, and radiotherapy. Those are kind of the old traditional ways of treating cancer. And there's also targeted therapy, which is unfortunately a very misused term, a bit vague. Generally, what it really means, though, is molecular targeted therapy. So, a therapy that targets something that kind of singles out cells as being cancer cells. So, cells in the human body are labeled on the surface. There are loads of labels, and they have things sticking through the cells from inside, going through the cell membrane. And targeted therapies are able to discover cancer cells because of the labeling. Unfortunately, not all cancer cells are labeled, and particularly with late stage cancer, it seems there are many cancer cells that are not labeled. So that's the first 4. So you've got surgery, chemotherapy, radiotherapy, targeted therapy. I try and call it molecular targeted therapy because it's a more useful name. Then you've got immunotherapy, which is a whole huge field of cancer treatments. I often come across patients who say, I've been told I can't have immunotherapy, I'm ineligible for immunotherapy. That's nonsense, because immunotherapy is not a single treatment. There's a very, very wide range of immunotherapies, some that have been established and are in general use and have been for many years. Others that are more experimental. Of course, there are lots of immunotherapy trials as well. But it's not really true that someone can be ineligible for immunotherapy. That's just part of the long list of dumb stuff that oncologists say because they're ill-informed or misinformed in this case, I guess you could say. Another way to treat cancer is with heat. This is called hyperthermia therapy. Confusingly, treating cancer with cold is, sometimes classed as hyperthermia therapy as well. For colon cancer, for example, there's a type of treatment called HIPEC, which is heated intraperitoneal chemotherapy. Radiofrequency ablation, you could say that's another example of hyperthermia therapy. So that's using a heated needle that's inserted into a tumour to ablate, kind of destroy the tumour tissue by raising it to high temperature. That can only be used in situations where the tumour is accessible. So relative, liver tumours are maybe good candidates for that. Possibly lung tumours as well. So that's hyperthermia therapy. Then there's metabolic therapy. So that's trying to damage the cancer cells by interfering with metabolism, forcing the cancer cells to take a kind of poorer form of metabolism. Those metabolic therapies often use off-label drugs, so it's using a drug for a purpose that it wasn't developed for. Metformin, for example, a diabetes drug seems to cause problems for cancer cells. Another point of metabolic therapy is that cancer cells are protected by, and cancer tumours in particular, by a layer of lactic acid in what's called the tumour microenvironment. This makes it difficult for white blood cells to get in and damage them, but it seems that using metabolic therapy inhibits the formation of that lactic acid. That lactic acid is a byproduct of the cell metabolism. So, yep, that's another reason why metabolic therapy may be effective. Currently, metabolic therapy is one of those ones that patients often do for themselves, so it's hard to get really good, reliable data. It's a lot of anecdotal data. And then I guess the eighth way to treat cancer is hormone therapy. This is, for example, for breast cancer, there's hormone therapies for that, prostate cancer as well. Yeah, so those are 8 ways to treat cancer. I'll go through them one more time. We've got surgery, physically removing the cancer, chemotherapy, using poison to kill cancer, radiotherapy, using either gamma rays or particles like protons or neutrons or carbon ions, that kind of thing. Immunotherapy, so that could be boosting the immune system, or it could be a drug that works in a way kind of mimicking the immune system, or the way that the immune system destroys cells. Hyperthermia therapy, so using heat to destroy cancer. Metabolic therapy, hormone therapy, and is that it? Is that 8? Maybe. Yeah, so hopefully those are the 8, and I've put a list in this video description as well. Okay, thanks for watching. I hope it was useful.